Hi everyone, and welcome to our second wave of COVID preparation. So we're really lucky today to have Roger Booker, UKHCA Deputy Chair, someone who's a sector expert and been running businesses in home care for over 30 years. So unfortunately Roger couldn't be available for Thursday's session, but he's very kindly offered to do a private Zoom call with myself recorded to give you some of the knowledge and pass over some of his wisdom. So without further ado, I want to pass over to Roger, and he's going to run through some of his thoughts, and then there'll be an opportunity on Thursday to ask any specific questions you might want myself and the team to come back to you on. So yeah, Roger, over to you.
Hi everyone, thanks for that, John. Yeah, just to talk about the issues of the potential second wave from a financial point of view as much as anything else, a business point of view, as opposed to specifically in insurance. The obvious things to say at this stage are to plan ahead, start thinking about issues now, don't be caught napping, but then that's why you're on this call. Consider what went well last time and what didn't go well, and therefore what you might be trying to do to influence things should the worst situation happen in the near future. I think that the impact is more likely to be localized going forward, certainly in the near term, with the possibility that issues move from one area to another. Right now, being in certain areas of the north of England is more of a problem than for providers who are operating in the south. I think other factors which are a change now compared to what they were like 6 months ago is that there is unlikely to be more money made available. So it could be much tougher for providers than it was back in March, April. Local authorities' spending is already stretched beyond the levels that it was before, so they are going to be in a more difficult position. On the positive side, right now, the staffing position today is significantly better than it was on the 23rd of March, which should help regarding shortages of staff, where lockdown kicks in or shielding applies. But you need to think about the fact that that may harden the line of local authorities if they believe the sector can more easily cope. Similar issue, PPE is more readily available, and likelihood is it's cheaper. But we need to think about the impact of regional lockdowns in particular with regard to the supply of PPE. So I think there are a number of key things with all of that I've just said in the background. The first thing I would say is speak to your commissioners, whatever service you're delivering, speak to them, keep that dialogue going, talk to them about the previous experience if you haven't already done so, and seek to engage them in a plan. You want to be trying to influence and contribute to the future rather than being on the outside. So emphasize the things that work well, the positive aspects. For home care providers in particular, the big one here is to say how well the shift from a time-based, time and task-based service to service delivery worked during lockdown. And I think that's key in terms of financial standing for providers to change the basis of contracts going forward to ones which move away from time, which takes a chunk of funding in reality away from both providers and, more importantly, away from the staff. So I think that's a key issue here. And that could be particularly relevant for those of you who have contracts which are expiring within the next 12 months. And to use this experience of emphasizing that time and task is an unsustainable model when dealing with matters of public health management, especially in a period of national crisis in the middle of an international pandemic. So influence the thinking of commissioners in respect of existing contracts, and also think more long-term how you influence the contracts that may be coming to the end of their life and influence the change in those. I think in this next phase, we also need to remember the impact of flu. That's really going to feed into to concerns in the public sector. Access to free vaccinations for the over 50s is not going well. So I'm not so sure that people are going to be able to get the flu vaccination as easy as that's been suggested in the past. People may be reluctant to get it anyway. The take-up amongst social care workers is not that high either. So this is going to have an impact potentially on workforce availability. But it's going to have a big impact on the public sector thinking in terms of fears on the pressure on hospitals. So all the more reason again not to revert back to contracts which are particularly focused on time rather than service delivery. So again, the issue of flu is quite an important factor here to ensure that councils take their responsibilities seriously and ensure that services are going to be much more lined up to assist us in not falling into the same difficulties that we've had over the last several months. Sure. Moving on to staffing, I think the fact that people have now got far more staff available to them than they had 6 months ago gives a better opportunity to develop a bigger bank. Most providers will probably already have a bigger bank. I think that people should now be engaging in a more detailed workforce management process. In particular, your data may be telling you that you've got maybe 20% more staff than you had before, but I think it's quite possible that a number of new recruits may be receiving little or no work because there hasn't been the volume of referrals that's been needed during this period of time. I've heard it from a number of providers who've said, rather bizarrely, from not having enough staff, then move to situations where they haven't got enough work to give to people. So I think that more close attention to workforce management should try and see people spreading the work more fairly amongst their workforce and avoiding the pitfalls of having still the 80-20 rule where 20% of the staff have got the biggest slice of the work. In a case where a pandemic hits, you've then got a bigger problem because you're not spread it around, and where your new recruited workforce potentially, who you think might provide the solution, actually may not be there because they haven't had the work, they've moved on, and while your data indicates that you've got the workers, they may not actually be available and available to take up the volume of work you might need them to do than you thought. So take a look at what's going on out there, for home care providers, talk to the coordinators and look at exactly how the work is being spread to ensure that you've got people whose earnings are sustainable and who can provide that cover should you need it. For residential-based businesses, the opportunity is for a bigger and better bank to mitigate against the need for you to be providing agency workers. You've got a much better opportunity to control your bank staff. They're cheaper. You're going to want to reduce agency working from the point of view of cost and also from the point of view of infection control. So I think now is the time to really look at that and plan it and think how you can better manage your workforce. The other area, the PPE was obviously a big issue during the previous period. It continues to be a big issue. Obviously, there's a big change in the way that PPE is now required for social care. I think you need to be looking at your supply chains, ensure that in the event of lockdown that you've got a robust supply chain. In particular, this will be an issue potentially in certain localities where you want to be sure that if an area of Greater Manchester is locked down, that your supply chain for PPE is going to enable you to continue to supply your staff in that area with the kit that they need. The other issue to think about is cost mitigation. If it is the case that social care commissioners in the public sector have not got the money that they injected last time, and I think that's likely. You might want to focus more keenly on cost mitigation. If you've had a business where your people have been working from home, and that's worked quite well, you might potentially want to think about the fact that if you've got some leases coming up for renewal, you might not need necessarily the same number of offices that you had before. Think about it, because cost mitigation could be an important issue, especially during this period of time before we get to March and the 1st of April, new financial year for local authorities and potential government funding changes. So I think that's an important thing. The government has put out the infection control grants, which had been much more available to be used by the residential-based providers. There are monies available to home care providers, but as I've already said, to residential providers as well. I think people need to be imaginative about how they might use that, not necessarily give up about making the claims for the grants. One of the areas that's possible is to think about issues that you may not have been able to address. So that might be staff well-being, for example, employee benefit schemes, to think about ways in which you might be able to claim that money and use it well to engage with your workforce. So I think those are the main points that I wanted to mention here, in anticipation of there being a localized and perhaps wider potential lockdown during this period of time. But I think for me the conclusion is to stick together, to talk to your other competitors. Everyone's in this together. To speak to peers and look to get the best collective outcome for the industry and for providers in the face of challenges both for providers and for public sector commissioners. The UKHCA itself is a useful avenue for sticking together, for collective guidance and to give support to people and encouragement during the difficult times. And then, as I said at the start, stay close to your commissioners, ensure that you're influencing those guys to improve and change the terms of your contracts, looking from the short term to the longer term. Thanks a lot.
Great, thank you, Roger. Really interesting there. Some real insight into the sector. I suppose the final thing for me, just to close off, is Roger has got some limited availability for some individual consultancy. So if there is any delegates on this webinar or seeing this webinar that would like some individual support and some consultancy from someone with Roger's wealth of knowledge, please do get in touch. I'll be happy to put you in touch with Roger. And if he's got some availability, he might be able to offer some wisdom there. So thank you very much. This is the first of, well, the sort of third or fourth actually of our series of webinars supporting clients with COVID. There'll be many more to come. If there are any specific areas you want us to follow up on, please do let us know. Thank you very much and goodbye.